Greater palatine ganglia. First, see this picture. First red color is showing internal carotid artery. Second, which is coming through foramen rotundum, that is maxillary nerve. Third is which is coming from the median canal or pterygod canal, that is median nerve. Fourth is pterygopalatine ganglia, or you can say hay fever ganglia. Fifth is greater palatine nerve. Sixth is lesser palatine nerve. Seventh is nasopalatine nerve, which is going into the incisive canal, or you can say incisive nerve, part of the nasopalatine nerve, supplying the septum. So this pterygopalatine ganglia having three main component. First is parasympathetic component, second is sympathetic component, and third one is sensory component. Now talk about parasympathetic component, which is coming from the superior salivatory nucleus or a part of superior salivatory nucleus, that is lacrimatory nucleus, into the facial nerve in the nervus intermedius, which coming through facial nerve into geniculate ganglia in the middle ear, which ultimately forming a nerve that is called greater superficial pituitary nerve, which going into the median canal. Second component is sympathetic component, which is coming through superior cervical ganglia into carotid plexus and ultimately forming the deep pituitary nerve, which is coming into the median canal. So median nerve is formed by the parasympathetic and sympathetic component. Parasympathetic coming from the lacrimatory nucleus, sympathetic component coming from plexus around the carotid artery or superior cervical ganglion. So this forms the median nerve. This median nerve is coming from median canal into the pterygopalatine fossa, and above it is a maxillary nerve. So this pterygopalatine ganglia is hanging in front of this median nerve or pterygod canal with the maxillary nerve, which is coming through foramen rotundum. So this pterygopalatine ganglia functionally related to facial nerve and topographically related to the maxillary nerve. The third component of pterygopalatine ganglia are sensory branches. So these sensory branches going into the orbit, that is called orbital branches, palatine branches, nasopharynx pharyngeal branches, lacrimal gland lacrimatory branches, and nasal branches. So these sensory branches are five: orbital, palatine, pharyngeal, lacrimatory, and nasal branches. So these sensory branches like palatine, greater palatine nerve, and lesser palatine nerve are main branches. Orbital sensory branches, lacrimatory, we supply the lacrimal gland through the zygomatic nerve, a part of maxillary nerve. Nasal branches mainly nasopalatine nerve, which is largest branch, and posterior superior nasal nerve, lateral branch, and posterior superior medial nasal nerve. So these are the branches which supply the sensory component of the nose. Now applied anatomy. Initially, median neurectomy designed for the refractory case of a vasomotor rhinitis, but having side effect of dryness of eye. So nowadays, more selective posterior nasal neurectomy done in the cases of only two indication: allergic rhinitis refractory to medication and vasomotor rhinitis. So doing this nerve is situated between the posterior end of the middle terminate and the inferior terminate, just inferior to the foramen, that spinopalatine foramen. And you can apply coblation, bipolar cautery just you have to elevate the small flap between the middle and inferior turbinate in the posterior part, and just elevate the periosteal flap, and you can cut cautery or stretch this nerve. So this is more than sufficient. But this nerve having three branches: anterior inferior branch, which is going to the inferior turbinate. You can see this is first picture is anterior inferior branch. Second is septal branch. C is in this picture is the superior terminate, which is going to the superior terminate or middle terminate component, that is posterior superior branch. These three branches are branch of the posterior nasal nerve. So doing this neurectomy, you are safe, there will be no dryness. So this is indicated only in allergic rhinitis and vasomotor rhinitis. Now very special point, if you add posterior nasal neurectomy with pharyngeal neurectomy, which is coming through palato-vaginal canal, so result are better than the only doing posterior nasal neurectomy. So you have to do pharyngeal neurectomy plus posterior nasal neurectomy in cases of refractory case of allergic rhinitis as well as vasomotor rhinitis having additive effect. Means this posterior nasal neurectomy plus pharyngeal neurectomy are more effective than the only doing this posterior nasal neurectomy. And another advantage of pharyngeal neurectomy, it's relieve the chronic cough which is because of postnasal drip by doing this pharyngeal neurectomy. So additive effect on the chronic cough due to posterior nasal drip. So this is another advantage. So this is the picture of palato-vaginal canal, which is pharyngeal nerve is coming. So you can cut bipolar whatever. So this is additive effect of postnasal neurectomy. Another applied anatomy, that is ice cream headache or cold stimulus headache, or you can say brain freeze. So this is ideal case in which if you are eating ice cream rapidly, that is going to stimulate your palatal branches, which is in the soft palate and hard palate, which stimulate this pterygopalatine ganglia, which signal to the brain, and there is vasodilatation and constrictions simultaneously in the brain vessels, leading to the brain edema, leading to this headache. So this is because of brain swelling induced by palatine branches through this pterygopalatine ganglia, leading to this brain freeze or ice cream headache.